Hello, everyone. Welcome to another interview of the Royal Dream interview series. Here we interview people who have broken barriers, who have gone beyond the expectation, the norms, and created history. People who have extraordinary effort, who put extraordinary effort to go the extra mile and cleared few of the most difficult exams outside India, namely the Royal College of Surgeons exams. Today we are with Dr. Santosh, who has cleared his M Perio RCS exam in the year 2017. And he's a very good friend of mine. I've known him since almost 5 years now, and he keeps amazing me every time I meet him. Today, we're going to look at his journey and see how M Perio has changed his life and how it can change a new graduate's life today. He'll also give us few tips and tricks on how to crack this exam. All this within a span of 30 minutes. Okay, thank you everyone for tuning in today. Welcome, Dr. Santosh. My first question for you, Dr. Santosh, is why did you choose to do M Perio exam?
Hi, Dr. Praveen.
Hi.
Yeah, it's my pleasure to be on your program. So, and share my ideas and views about this examination. Yes, I started my journey, yes, in 2016 to prepare for this examination. We started collecting all the information and things about this, and I got to know through my friend actually about this M Perio examination from the Royal College of Surgeons of Edinburgh. So basically, this is an exam which is actually an exit exam in the United Kingdom for the specialists who are completing their master's degree there. So unfortunately, we don't have an exit exam in India because when we sit for the university examination, so we consider that as the final and then we register as a specialist. That's how it is in India. So in other countries, it's like you need to sit for an exit examination when after completing their master's degree. So only after they complete this examination, that is considered as an endpoint of clinical training. So then they will be able to register in their respective countries, and it will be put in the public registry as a specialist.
Okay, so basically you're telling me that this exam is like after you finish your postgraduate training, this is like an exam that determines you whether you are up to the UK standards or not, whether you've completed.
Yes.
Okay.
Yes.
And is this exam open to international students as well, or only for people who are trained in the UK?
So usually there are actually different royal colleges across UK, and we have royal colleges in Ireland, we have royal colleges in Canada, and in Australia.
Okay.
So usually, if we have to sit for any of these exams, you have to be done your studies in the respective countries. But the only college which is actually open for international candidates, where you can sit from overseas, and also they conduct exams outside United Kingdom, is the Royal College of Surgeons of Edinburgh.
Oh, that's great. So that's pretty good opportunity for international candidates to be.
Yes. You can show your skills and your competencies at a standard which is set by the Royal College, which tells you that you are equivalent to the specialist who's sitting for this examination and who's graduated from UK. So they are setting that standards.
That's great. Now, I've heard that to practice in the UK, the exam that you need to give is ORE. Now, if I do the M-Endo exam, do I still need to give ORE? The M Perio or M-Endo or any of these specialty exams from the Royal College. If I give this, do I still need to give ORE or LDS to work on patients?
So basically, when you actually applying for licensing or registering as a license to practice dentistry in these countries, your basic dental degree should be recognized by them. So what happens is, if you have done BDS out of these countries, either you should have studied your BDS from UK, Ireland, Canada, USA, or Australia or New Zealand. So if your BDS is not from this country, so what happens is that even though you sit for a specialty exam and get the membership examination of the Royal College. If to practice to register in the General Dental Council, your BDS should be registered first before you register your MDS. And for that to happen, you need to sit through the licensing examination, which is conducted for the undergraduate examination. That is for people with, our basic dental qualification should be recognized. So for that recognition, you need to go through this ORE examination or the LDS examination, and then register as a general dentist first in the GDC. All right. And then you can apply for the specialist registry, considering that you have cleared the Royal College examination in the individual monospecialties or first level dentist. So an endodontist or a prosthodontist or a periodontist. So just with our degrees from India or from Southeast Asia, any of the countries, whether it is Sri Lanka, whether it is Pakistan, Bangladesh, Bhutan, so none of the undergraduate degrees are recognized there. So even though when we have these degrees after passing the Royal College exam, this cannot be used to practice dentistry in.
So what is the actual use or the the application of this degree outside our country? What do you think? How do you think it's helping us?
Usually, as we discussed, that it actually sets a standard at a specialist level as per the GDC requirements. So they have certain skills and competencies which needs to be satisfied before they go for registration. So that is basically tested by the Royal College. Okay, so because it is an exit exam. So as an international candidate, when we sit for this examination, so we are trying to show that your degree, which is actually, if you're from a different country and if it is not recognized internationally, you get an international recognition by completing this membership examination.
So basically an international recognition. So I know that you're in Kuwait. How much value does this degree have in Kuwait or any of the Middle Eastern countries?
Middle Eastern countries, usually what happens is like when you apply for the registration here, so if you have anything from the Royal College certification or a membership or a fellowship, you can get better job prospects. You have a better CV. And also, in terms of promotions, it helps you better if you want to apply.
Promotions, job prospects.
To just having a master's degree.
Absolutely. So you're telling me in the Middle East, you have a better chance of landing a job and getting promotions if you have this particular M Perio RCS degree.
Yes.
Okay, that's great. So by what you're saying, what I can understand is that in the Middle East and few other countries, it just boosts your CV for you to land better jobs. And in the UK, it probably gives you an edge over others to register yourself as a specialist, but not directly to practice. But you can register yourself as a specialist after you clear their country's licensing exam.
Yes. You have to first register as a general dentist, and then you can register.
Got it. What are the prerequisites to apply for this exam? Do we need to complete anything?
There are two things. Either you have a 36 months completed degree, master's degree, 3 years, so you do it in India, or it should be under supervision that you work in a hospital or under a division which you are interested. Like it's not a kind of a university program, but it's a kind of a hospital program where you work under supervision for 36 months, and then you need some proof that you have done some cases, and then you can sit for this exam.
Okay, so basically you need to have supervised training for 36 months.
36 months.
In our country, it's mostly MDS, or if you had any 36-month supervised training in any hospital, probably you can give this exam.
Yes.
Right? Okay. So if I have to, I understand that many periodontists are watching this program. They would like to know how much effort or how much time is needed to actually prepare for this exam.
Frankly speaking, it does take some time because now there are two aspects here. One is if the person is freshly graduated. from your master's
Okay.
degree, or a person who is an experienced clinician after a few years you want to give sit for this exam. So the best thing to do is to give this examination immediately after the MDS examination, so that you're
Oh,
fresh out of examination and it is easy to study because you're already fresh with the knowledge and you just
that,
have to refresh
yeah.
according to the stuff, the pattern that they ask in the exam. The only thing that we have to be concerned here is that the preparation should be according to the the blueprint what the examination actually has published on the website, and prepare
Okay.
accordingly. That's it. Because the examination what we go through in India is slightly different than the
Okay.
way it is conducted in India.
So talking about the preparation, what tips or what are the areas that the candidate has to cover or study to crack this exam? Can you give us an overview of what all he has to study?
First is regarding the time, the duration of preparation. So it needs at least, if you're a fresh graduate, maybe 2 to 3 months is sufficient. But if you have a gap of studying and you've been practicing and you want to sit for this exam, I would recommend at least a 6 months, a minimum time. Maybe some people
Six
might
months
need
of preparation.
of preparation is
Okay.
required for this examination because it takes some time to understand the pattern and to go through the questions and to understand and analyze them and answer. It's slightly different than what we have it in India, so it will take around 6 months.
So, Dr. Santosh, you tell me that it's slightly different from India, from Indian exams. How different do you suggest it is? Like, why do you say it's different?
So basically, in India, what happens is that we are having only like two parts of the main examination. So one is a theoretical exam that we write for a given question we need to answer, and it's marked. And then we have a practical examination and an oral examination, right? Whereas in this exam, so usually we have the similar kind, but it is most of a clinical based examination. So with applied
Okay.
basics. So they don't ask you like a single question and ask you to write an essay or write a short notes or short answers or something like that with a single line question. So it is a clinical scenarios or a scenario based questions wherein which is a clinical case, and you will have related questions following that.
Okay.
So that is how the theory paper will look like, question paper will look like. All right. So, and then
Oh,
we
so
have,
it's not going to be like a, so it won't be like define composites or tell me the composition of GCF or something like that. It's not going to be like that. It's not going to be a
correct.
memory based.
It's not a completely memory based, but yes, it is partially memory based, but you have more of application in this skills that
Application.
you show in the examination. And then you have followed by oral examination. So you have
Okay.
some cases that will be kept for you, not physical cases, it's just case records. So you need
Okay.
to go through them and then review them and make your notes, and then you sit for a structured oral examination. So
Okay.
you will be asked questions by two examiners relevant to that case.
Okay.
So, yeah.
Can you give us some example of a typical question that would come in the exam in the
So
orals?
basically, yeah, basically what happens is your theory paper examination, you have two papers, right? So usually one paper will be in the morning, another one in the afternoon. So each paper is duration of 2 hours, and it will be like kind of multiple short answers. Like I said, it is not an objective type examination. So this should be very clear. It's not a multiple choice questions or an objective type where you have a question with where you need to choose the best answer of the given choices. It is a question. It's a scenario based clinical examination. So you will have approximately around 10 to 12 questions in the theory paper, and each question will have sub questions of around 4 to 5 uh, further questions. So you
Can
need
you
to
give me an
revise.
example?
Yeah. So basically, say for example, you have a question on periodontitis.
Okay.
Now you will be given a case history, a brief history, and the past medical history, and the clinical examination findings, and the clinical pictures, radiographs, all the supporting investigations. And then
Okay.
they will ask you questions like, what would you think would be the likely diagnosis of this case?
Okay.
why do you think that you feel that this is your diagnosis? Justify your
Okay.
answers with certain points.
Okay.
All right. And if there is any positive finding in the case, that they would ask you, like, if there is a tooth mobility, like, why in this particular case do you think that there is tooth mobility? They don't want to know in general, or they might ask a general question that can you enumerate the causes, causes of tooth mobility? So it can be
Okay.
either of the two. Either they ask you a question which is specific to it, or it can be a general question.
Nice, nice.
And
Thank you
then,
for the
like further, like if they can ask about risk factors and if it's about
Okay.
smoking, diabetes, etc.
Okay.
So once you
Okay.
give a diagnosis, how are you going to formulate a treatment plan? So even that. Now,
Okay.
sometimes when they ask about treatment plan, they'll give the entire page empty and they will score, like you will be given marks on the right hand side, like so you know how much to write. That is similar to the Indian exam. Like if you have a 2 mark question, you would not like to write a very elaborate answer. In a similar way, if you have a 5 mark or a 10 mark question, you know how much to write. So in a similar way, marks are
Right.
awarded for each question and you will know how much to write.
Got it. Got it. So it looks kind of doable. I think Indian candidates can clear this exam, but like you say, they need a little bit of training. They have to get used to the clinical orientation,
Yes.
the problem solving sort of scenario. They should be, exposed to it. I get it. Great. So once a student decides to give this exam, how much cost do you think is going to incur? What is the uh, fees, and does it happen in India, or do they have to go outside India to do this?
The cost of, see, this exam, the eligibility to, first you need to get eligibility to sit for this exam. So you need to
Okay.
apply for the exam and it would cost you around 1,500 British pounds.
Okay.
Now, when you apply for this exam, you have 4 maximum attempts to clear this exam.
Okay.
So if you do not clear in the 4 attempts, then you cannot sit for this exam ever.
Okay.
That's important.
Good. So 1,500 pounds totally, or for every attempt they have to pay for?
Yeah, you need to actually, when you sit for the first time, you pay the complete amount of 1,500 British pounds, and they have
Okay.
some leverage above when you resit as a candidate, because if you are resitting only for the theory exam, then they charge only for the theory. Or if you are resitting only the practical option or the oral examination part, they will charge you.
That's great.
But when you
That's
resit
great.
the third time, you resit as a fresh candidate again.
Oh, so
Like
they do.
parts of the exam. Yeah.
They do allow you to carry over certain
Yes.
aspects of the exam if you pass. Okay, that's good. That's good news for all the candidates.
So the carryover is only for 1 attempt.
Only for 1 attempt. Okay, got it. Now, if I give this exam, what is the chance that I'll pass? What is the usual pass percentage?
See, if it comes so usually the pass percentage is around 50% in Perio exam.
Oh, not bad, not bad. Okay, for an international exam which has such high caliber and weightage, I think 50% is a pretty good pass mark. Quite doable. Great. Now, we spoke about this, the importance of this exam outside our country. Is there any use of giving this exam for people who have decided to settle in India? If should an person who's practicing 10 years of who's been practicing in India for last 10 years, an MDS in Perio, should he consider giving this exam?
All right. See, now I think there is some changes in the policy in the Royal College. I think they should first write to them and see if they are first eligible to sit for this exam. So this exam is considered as an exit exam for specialists in that country. So usually they will have a time duration that after maximum after how many years after MDS that you can sit for this exam. Now sometimes if you have completed more than 10 years, you are not eligible to sit.
Okay. Sometimes.
I need to clarify with the college. So, like the minimum, if you are within that range, that you can apply for this exam.
Or if I'm within that range and I say I'm a 5-year-old practitioner, what do you think I should be applying for this exam, being in India?
Yes, it's better to apply as early as possible, because the more it takes time, it's not, you have to again go back and study everything what you study during your post-graduation time, and it will take more time to prepare for the exam.
Right, right. And I think being in India, being a clinician, I think most of us forget our basics. I think this exam in particular, like you say, has a lot of clinical components and basic components. So it's going to help us revise and refresh what we already know. So I think it's a pretty useful exam to give for practitioners in India who are not planning to go abroad as well.
So
So that's
so basically, it is an international recognition, and
it
it
gives
will
a
make
chance.
you a better clinician
Yeah,
once you go through this examination, because you will start thinking from a different angle of problem solving,
absolutely.
ideas, and your problem solving skills will improve following this examination. So it's more of a case oriented, like it will be more targeted towards that. So you will become definitely a better clinician once you prepare exclusively for this
Um,
exam.
that's great. I kind of felt that in my practice as well. After finishing M Endo, I started presenting success rates and different treatment options with evidence. I presented with evidence to my patients. Maybe they would never even go back and look through it. But then when you present, it gives you more. When you present it this way, I think patients trust you better. You feel more confident about your own treatment plan. It
And also
changes your entire
it's
perspective.
value for your patients and treatment that you're
Yeah,
providing.
yeah.
So
And a funny thing is that when I keep my degree on my waiting area, and then patients have actually asked me, Doc, oh wow, I was in the UK, so even you've done a course from the UK Royal College. A lot of people recognize Royal College, and it is a pretty, neat thing to have even in India. A lot of people are
it's,
recognizing
it's a very
something.
common thing for the medical professions to have the certification. So many of
Yeah,
the surgeons usually have that as a membership or a fellowship from the Royal College.
right,
It's usually very common in India.
right. It's
Now
called
in Delhi
MRCS.
also we have this. Yeah.
Correct. It's called MRCS in the surgical field, FRCS after a few years. Yeah, absolutely. So I also want the audience to know that Santosh is a part of our academy, the Royal Film Academy. So we've been training M Endo, Perio, and Prosto students since last 3 years, and we've been helping them clear this exam. So back in the days, I think me and Dr. Santosh we struggled a lot to clear this exam. We
There
in
was no
fact
one
failed
for
our
us
first
to
attempt.
guide us, to tell the path and to say like what to study, what not to study for this exam. And
Exactly.
yeah.
Exactly. We were
Now,
really desperate for guidance. So I'm really happy, and I thank God that we are in a stage that we can help other students go through this exam and guide them with whatever knowledge we have. So thank you all for listening. Thank you, Dr. Santosh. It was so nice of you to give us your time and share your knowledge.
thank you so much for having me on your program, Dr. Varun. Thank you so much. Have a
Thank you,
nice
Santosh, sir. Any last minute words for young periodontists out there?
I would say that now, because there are many postgraduates are coming out from dental colleges, if you would like to stand from something which is everybody is good, but if you want to be something who is extraordinary and stand out of the box, that would help you, especially when you're applying for jobs, either within
Yeah,
India or even for abroad jobs. It would definitely help you to build your CV. You're improving your clinical skills, and it's also as you'll be using it as a post-nominal qualification. So you're going to use it like after MDS, you're going to use it as M Perio or M Endo RCS. So that gives you more
absolutely.
value for yourself and also for your patients. So
Absolutely.
I would definitely recommend the young graduates who are passing out with perio specialty to sit for this examination. This is equivalent to a board certification, just like how we have it in US, and even India has orthodontic board society. So similar, it's like a board certification examination. So this has an international recognition.
Great. That's great. That's great. I hope all you young minds are inspired and go for this exam. All the best, everyone. Thank you, Dr. Santosh, for your time. Have a wonderful day.
You too. Thank you so much. Bye bye.
Bye.